Hi, I'm Dr. Sheridan. Let me share with you how I can help you with your disc bulge. We have specific therapies for the reduction of pain, decrease muscle spasm, increase your mobility, and also help you with your symptoms of disc bulging. For example, in the neck, if you're having numbness and tingling in the arms and hands, inability to move your head from side to side. Also in the lower back with disc bulge, you'll probably have sciatica, pain radiating down the legs causing numbness and tingling. The reason why it's so important for these therapies is that it helps with your lifestyle. For example, work. You can work without pain, you can stay focused and not affect your ability to be producing at work. Also, two, sleep better, sleep fully at night without tossing and turning to get your head in the perfect position so you can get a full night's sleep. And also to help with your activities of daily living. For example, if you have a disc bulge in your neck, it affects your ability to wash your hair, comb your hair, look from side to side, lift your arms above your head or reaching. If you have a disc bulge in your lower back, symptoms can help you with getting dressed, like putting on your pants and shoes without pain, or getting in and out of the car without pain. In my 25 years of experience, the most common cause of disc bulge is due to trauma or wear and tear. Wear and tear would cause a disc bulge, trauma would cause a disc herniation. For example, a disc bulge is where for example, a jelly donut, the jelly is kind of pushing to the outside, whereas a disc herniation, that jelly donut, the jelly comes out of the donut into the nerves. So the most effective treatment for disc bulge is, number one, electrical muscle stim, which is a mild current that helps reduce pain, decrease inflammation, and decrease muscle spasm. Number two, chiropractic spinal manipulative therapy to help restore motion in the joints, to take the pressure off the nerves and decrease that disc swelling. And also axial traction, which is a traction that opens up the disc space to help that jelly donut to absorb that jelly back into its space, and also to take the pressure off the nerves to decrease muscle spasm and increase mobility. I want to share a story with you of a patient named John, how effective our treatment and therapies were for his disc bulges. John had a trauma where he was bending over and he had a sharp pain in his lower back, which resulted in a disc bulge. It caused him where he could not work, he could not bend, lift, pick up his kids, could not sleep at night. And after one treatment, his symptoms decreased by 50%. And after 2 weeks of treatment, he was pain-free. The reason why John chose us is because I'm a certified medical examiner for the Department of Transportation and the Federal Motor Car Safety Administration. I'm certified by the American Medical Association in impairment ratings, and also certified in diagnosing and treating disc bulges. So if you're suffering with a disc bulge and in pain, we have a new patient special, which is a $79 new patient special, which includes a consultation, 4-point exam, 2 x-rays if necessary, treatment, and a bonus. The reason for the consultation is we want to know exactly the mechanism of your disc bulge and what modalities and treatment will be best to resolve your disc bulge and get you out of pain as soon as possible. The 4-point exam includes range of motion testing to see how much restriction there is in the joints, decreasing your ranges of motion, muscle testing to see specifically what muscles are involved with that disc bulge, nerve testing to see exactly what nerves are being affected, and also orthopedic tests to see if there's any damage to the ligaments, tendons, or the cartilages of the joint. The reason why we do this again is we want to know exactly the mechanism of your disc bulge and what modalities and treatment would be best to reduce your disc bulge and get you out of pain as soon as possible. The reason why we do x-rays is so we can get a better look inside to see what's happening, treatment to get you out of pain as soon as possible, and the bonus is a bottle of BioFreeze, which is an all-natural pain-relieving gel, and to help reduce the pain. We have also a 2-part guarantee to that new patient special. The first part is we're going to do a consultation evaluation to determine if we can help you with that disc bulge. And if we can't, we're going to refer you to the specialist who can. So there'd be no charge and you get to keep the bottle of BioFreeze. The second part of that guarantee is if we do decide we can help you and you're not satisfied with the treatment or any services we provide in the office, there will be no charge and you get to keep the bottle of BioFreeze. This offer is limited to 10 new patients per calendar month due to capacity restrictions. So if you're suffering with a disc bulge or in pain, I urge you to call 951-672-8060 so we can help you get out of pain as soon as possible.